Have you ever stopped to question whether the way you engage with your own body, especially in moments of private intimacy, is still aligned with what your body actually needs after the age of 60? You're not alone if you've wondered. This is not just a medical concern, it's a deeply human one. And yet, for so many men, it's a topic that stays hidden in silence. The real question isn't simply, is it still okay? But rather, how do I honor this part of my life in a way that supports my health, preserves function, and sustains my confidence? Take a moment right now and reflect on this. Could it be that the habits you've repeated for decades, methods that may have served you well in earlier years, are now misaligned with what your body needs today? Are they, in some ways, quietly working against your long-term well-being? Here's the uncomplicated truth. Mature male sexuality is not something to be ashamed of. It's not a flaw. It's not indulgence. And it's certainly not something you grow out of. In fact, when masturbation is approached with awareness and care, it becomes not just a source of pleasure, but a legitimate tool for supporting male health as you age. Clinical research and urological practice consistently show us that healthy self-pleasure in older men offers measurable benefits. It promotes circulation, particularly to the pelvic region, supports healthy testosterone balance, helps the prostate remain active, regulates cortisol, improves sleep, and even soothes the autonomic nervous system. But, and this is key, what worked at 25 is unlikely to still serve your needs at 65. That's not a personal failure. That's just human biology expressing itself over time. Physical aging changes everything. Blood flow, nerve sensitivity, tissue integrity, and hormonal signaling. This means the techniques you use must evolve too. If they don't, the risk grows for issues like reduced sensitivity, chronic irritation, pelvic tension, and emotional frustration. I'm Dr. Catherine Anderson, a board-certified urologist with specialized experience in men's sexual health across the lifespan. For over 5 years, I've worked directly with men over 60 to help them regain clarity, comfort, and dignity around this very intimate part of life. And let me tell you, you're far from alone. Many of the men I've met felt confusion, guilt, or even embarrassment about what they were going through. Some pushed through discomfort, ignoring signs their bodies were trying to communicate. Others assumed this decline was simply part of aging, but decline is not inevitable. Adaptation is key. Let me walk you through 3 of the most common mistakes I see men make when it comes to self-pleasure after 60, and more importantly, how to avoid them. First mistake: rushing the experience. Far too many men have internalized the idea that masturbation should be quick, secretive, something done in haste and wrapped in shame. But what you do in those few minutes has ripple effects across multiple body systems. When you rush, you activate your sympathetic nervous system, your fight or flight state. Blood vessels constrict rather than dilate. Muscles stay tense, and your brain begins to associate touch not with comfort, but with urgency, or even anxiety. The result? A decrease in pleasure, a dampening of sensitivity, and a nervous system that leaves you feeling stimulated, but not satisfied. The solution may sound simple, but it carries profound neurological impact. Slow down. Literally give yourself 5 extra minutes and take several deep, diaphragmatic breaths. Eliminate external noise. Mentally arrive in your body, not in your head. When you move with presence instead of pressure, you allow the parasympathetic system, the body's rest and restore mode, to take over. That's when relaxation, arousal, and healing intersect. Second mistake: using excessive pressure. This is probably the most frequent concern I see in clinical practice. As men age and natural sensitivity diminishes, largely due to nerve aging and gradual reductions in testosterone, many attempt to substitute pressure for sensation. Suddenly, what used to feel stimulating now requires intensity. Tight grips, fast motion, friction-heavy movements. Your penis, however, is made up of fine vascular structures and delicate sensory nerves. Over time, excessive pressure can cause subtle trauma, leading to nerve desensitization, vascular stress, even micro tears. There's even a term for this in sex therapy settings, death grip syndrome, where only one form of highly specific stimulation produces a response, and traditional intimacy becomes unsatisfying or even impossible. The fix? Retrain your body. Practice a gentler technique. Apply a quality, fragrance-free lubricant to minimize friction and mimic the kind of touch associated with intimacy, not force. Think of it as a therapeutic massage for your circulatory and nervous systems. It may take patience, but your body does learn, and you'll likely rediscover levels of sensation you thought were lost. Third mistake, suppressing emotion. This is the most overlooked aspect, and arguably the most important. Healthy sexuality is not just a physical exchange, it's an emotional and psychological experience deeply rooted in how we see ourselves. If you're silently carrying decades of shame, judgment, or discomfort about your own pleasure, perhaps from early religious conditioning or societal narratives, those emotions aren't just mental. They manifest in your breath, your posture, your pelvic floor tension, and ultimately, your ability to experience arousal and release. Science now confirms what many clinicians have long observed. Emotional stress directly impacts the hypothalamic pituitary gonadal axis, the hormonal system that governs sexual function in men. Toxic stress even impairs nitric oxide production, which is critical for erectile function. So what can you do? Start with self-acceptance. Understand that what you're doing is normal. It's healthy. Remind yourself regularly. You are not broken. You are not past your prime. You are simply in a wiser, more nuanced phase of life that requires greater self-kindness. Let yourself be curious again about your body, all its evolving responses. That alone can unlock deeper pleasure. If the emotional weight ever feels too heavy, speak to someone. Whether it's your physician, a licensed sex therapist, or simply a trusted friend, you don't have to carry this silently. Emotional safety is every bit as important as physical safety when it comes to sexual well-being. So how do you create a self-pleasure practice that is actually good for your health, rather than something that diminishes it? First, treat this as genuine self-care. Wash your hands thoroughly. Use clean, fresh towels. Choose a private, safe space where your nervous system can fully relax without fear or embarrassment. Second, use lubrication. A neutral, unscented lubricant not only prevents microabrasions, but improves blood flow, helps preserve skin elasticity, and enhances overall stimulation. Third, listen closely to your body. If you notice discomfort, pain, swelling, or unusual redness, pay attention. These may be signs of underlying inflammation, circulatory issues, or prostate changes that require medical evaluation. Finally, be patient with yourself. Aging does not mean the end of sexual pleasure. Quite the opposite. In many cases, men in their 60s, 70s, and beyond report having more fulfilling, emotionally resonant experiences than they ever had in their youth. Why? Because they slow down, they listen, they adapt. Rediscovering your sexual self after 60 is not a regression, it's an evolution. It's a conscious shift from performance to connection, from pressure to presence. Your body still matters, your well-being still matters, and your right to experience pleasure and confidence remains just as valid as it ever was. So the next time you find yourself in a private moment, bring compassion. Let go of guilt. Dismiss the old idea that speed or intensity equals satisfaction. Instead, honor your needs as they are today, with presence, patience, and above all, respect. Aging doesn't mean your best years are behind you. In truth, it can be the beginning of a richer, more integrated relationship with your body and mind, one rooted in wisdom, strength, and true confidence. If this message has resonated with you, I invite you to subscribe to this channel. Here, we talk openly and respectfully about men's health, without shame, without stigma, and always with clarity. Leave a comment below. Tell me where you're watching from. And let's start having the conversations that so many men have silently waited for. Until next time, I'm Dr. Catherine Anderson. Stay informed, stay empowered, and most of all, take good care of yourself.